Compression injuries of the chest. Overview. Compression injuries of the chest occur when the thoracic cavity is subjected to a significant force, leading to damage to the ribs, sternum, lungs, heart, or other structures in the chest. These injuries are often associated with blunt trauma and can result in life-threatening complications if not promptly diagnosed and treated. Causes. Compression injuries typically occur due to 1. Motor vehicle accidents, sudden deceleration or seatbelt injuries. 2. Industrial accidents, heavy objects falling or being pressed against the chest. 3. Crush injuries, being trapped under debris as seen in building collapses or natural disasters. 4. Sports injuries, direct impact from equipment or other players. 5. Explosions or blasts, the pressure wave can compress the chest rapidly. Types of chest compression injuries. 1. Rib fractures. Fractures are the most common chest injuries from compression. Painful breathing, pleuritic pain, and shallow respiration are common symptoms. Complications include pneumothorax, air in the pleural space, or hemothorax, blood in the pleural space. 2. Sternal fractures, typically caused by direct anterior chest compression, often associated with heart or lung contusions. Patients may experience localized pain, swelling, and difficulty breathing. 3. Pulmonary contusion, bruising of the lung tissue due to compression, causing alveolar hemorrhage. Symptoms: shortness of breath, hypoxemia, and hemoptysis. Often leads to impaired gas exchange. 4. Cardiac contusion, blunt trauma to the heart muscle leading to arrhythmias or myocardial dysfunction. Symptoms include chest pain, hypotension, and irregular heartbeats. Electrocardiogram (ECG) is like changes in cardiac enzyme elevation help in diagnosis. 5. Flail chest occurs when multiple adjacent ribs are fractured in multiple places, causing a segment to lose its structural integrity. Results in paradoxical chest wall movement during breathing. Requires immediate stabilization and ventilation support. 6. Pneumothorax and hemothorax. Pneumothorax, air enters the pleural space, causing lung collapse. Hemothorax, blood accumulation in the pleural space due to vascular injury. Symptoms: respiratory distress, hypotension, and decreased breath sounds on the affected side. 7. Diaphragmatic rupture. High impact trauma can tear the diaphragm, allowing abdominal organs to herniate into the chest cavity. Symptoms include dyspnea, chest pain, and bowel sounds heard in the chest. 8. Esophageal or tracheal injuries. Rare but serious injuries that can occur with severe chest compression, present with dysphagia, subcutaneous emphysema, or air leakage. Symptoms and signs of compression injuries to the chest may include severe chest pain, difficulty breathing or shallow respiration, deformity or instability of the chest wall, bruising or abrasions over the chest, signs of shock, low blood pressure, rapid pulse, cyanosis, bluish discoloration of the skin due to lack of oxygen. Diagnostic workup. 1. Clinical examination, inspection, palpation, and auscultation of the chest. 2. Imaging studies, chest X-ray, to detect fractures, pneumothorax, or hemothorax. CT scan provides detailed imaging of chest injuries. Ultrasound EFAST used in trauma settings to identify fluid or pneumothorax. 3. Laboratory tests, arterial blood gas ABG to assess oxygenation. Cardiac enzymes for suspected myocardial contusion. 4. Electrocardiogram ECG to identify arrhythmias or cardiac injury. Management. 1. Initial stabilization ABC approach, airway, ensure a patent airway, intubate if necessary. Breathing, administer oxygen or provide mechanical ventilation for severe cases. Circulation, control hemorrhage and maintain blood pressure with fluids or blood transfusion. 2. Specific treatments, rib fractures, pain control and pulmonary physiotherapy to prevent atelectasis. Flail chest, pain relief, oxygen support, and possible surgical fixation. Pneumothorax, needle decompression or chest tube placement. Hemothorax, chest tube insertion to drain blood, surgical exploration if bleeding persists. Cardiac contusion, monitor and treat arrhythmias or heart failure. Diaphragmatic rupture requires surgical repair. 3. Surgical interventions, thoracotomy for extensive internal bleeding or organ repair, rib plating for unstable fractures. Complications, respiratory failure, persistent chest wall pain or deformity, chronic pulmonary complications, e.g., lung scarring, post-traumatic stress disorder, PTSD in severe cases. Prognosis, The outcome depends on the severity of the injury and the timeliness of treatment. Mild injuries like isolated rib fractures have a good prognosis, while severe injuries like flail chest or massive hemothorax require aggressive management to prevent fatal outcomes. Prevention: use of seatbelts and airbags in vehicles, wearing protective gear during high risk sports, adherence to safety measures in occupational settings.